need to promptly diagnose and manage diabetes per se, as well as to assess the risk of cardiovascular disease in a diabetic patient when we diagnose. And lastly, we need to see how to assess the risk of cardiovascular disease in a diabetic patient and how to prevent and manage those risk factors so that the ultimate morbidity and mortality is reduced. Do you think there is some difference between type 1 and type 2 diabetes as far as cardiovascular disease is concerned?
There are two aspects here in terms of the risk factors that actually lead to cardiovascular disease, and possibly also differences in the pattern of coronary artery involvement. For example, if you look in type 1 diabetes, the cardiovascular disease is more closely related with hyperglycemia per se, whereas, like you very rightly mentioned, in type 2 diabetes, there are several other bits and pieces which actually contribute to the risk of cardiovascular disease in type 2 diabetes, like hypertension, obesity, dyslipidemia, smoking and all of that.